back, my YouTube friends and family. This is Lindsay, and I am back with another daily work from home job leads video for you. In today's video, we have 7 different job leads and companies that are hiring in the healthcare field. All of these jobs are non-phone based, so they are not customer service taking inbound calls. I do work as a hiring manager for my full-time remote job in the healthcare field, and there is no better time than now to get in the healthcare field if you want something that is mostly non-phone and if you want to be working from home. The links to all the pages that I share are always linked in the YouTube description box below this video. I do try to do my own research on all the companies that I share before sharing them, but as always, I please caution you to do your own research before giving your personal information to any of these companies. And if you enjoy videos like this or videos where I am sharing multiple job leads, please give this video a thumbs up like button. That will give me direct feedback that this is being helpful to someone. But first up, we have the company BrightTree. They are part of ResMed. Now, they have 173 reviews from current and past employees on Glassdoor, and they have a employee satisfaction rating of 3.4 out of 5 stars. They are hiring a quality assurance specialist for their cash posting division. Now, one thing to note, I don't work for any of these companies. I don't have any additional information outside of what is shared in these job postings. A lot of them will have the main headquarters address listed, but if you go down, most of them hire throughout the United States. If they do have any state restrictions, most of the time they will state that. But BrightTree by ResMed is a technology company. They are in the medical technology field. They are looking for somebody to report to the cash posting team lead and be responsible for the quality and achievement of their cash posting. So you'll accurately post payments received from multiple sources and multiple clients. You'll reconcile deposits and resolve any complex discrepancies. You'll review remittance advice or basically an explanation of benefits from the insurance company, letting you know what they approved, denied, the contractual rates, all that, and you'll assure appropriate payments, adjustments, balance transfers, and recoupments are completed accurately. You'll respond to inquiries regarding the payments and reconciliation. You'll perform quality reviews on the cash posting transactions to make sure that they were completed accurately according to all the policies and procedures that are established. You'll also help make procedure recommendations and update the procedure documents for optimal performance. So if you notice something isn't working well when you're following the policies and procedures, you'll bring that to your manager or supervisor. Now, this does not require any kind of college degree. They want somebody who has a high school education or GED, somebody who has at least 2 years of DME or respiratory experience, someone who can be a self-starter, troubleshoot challenges, great communication skills, and be a multitasker. Now, in the healthcare field, most jobs are going to require you to know how to use Microsoft Office basics like Word, Excel, Outlook for email, and this job is requiring that as well. Now, pay is always going to be dependent not only on location, but also experience that you bring to the table. Pay for this position is anywhere from $16.30 an hour all the way up to $24.44 an hour. Next up, we have Cornell Medicine. They have 1.4 thousand reviews on Glassdoor with an employee satisfaction rating of 3.9 out of 5 stars. They are hiring a revenue specialist for their AR division. Now, one thing to quickly note, this pays very well because they are based out of New York, and so their salary is anywhere from $29.15 an hour all the way up to $38.96 an hour. But you're going to join their team of revenue cycle professionals for their central business office. You'll apply your knowledge of AR follow-up and investigate and resolve payment denials and identify trends. So this is basically a billing follow-up insurance job. You'll perform extensive follow-up to investigate and resolve any payment denial trends. You'll assist with the development and implementation of strategies and procedures that'll reduce denials, maximize reimbursements from the insurance company, and promote faster payment. You'll utilize the practice management system to sort, filter, summarize, and identify accounts receivable trends from payments from the insurance companies and patients. You'll prepare any letters of appeal to the insurance companies for claims that were not paid or paid the incorrect payment rate. You'll resolve claim edits with the practice management billing system to make sure successful claim submissions. So you'll double check those claims, make sure everything is good to go before sending them to the insurance company to help cut down on the insurance company denying the claim and not paying it. Again, this position only requires a high school diploma or GED, no college degree. They would like somebody who has 3 to 5 years of some kind of medical billing experience, somebody who knows something about insurance reimbursement, someone who has great communication skills, those critical thinking and analytical skills, because you're going to have to look at an account and try to figure out why the insurance company didn't pay it, what is wrong with it, and sometimes those issues are not just glaring. You have to kind of search for them. You do need to be a multitasker and again, know how to use that Microsoft Office suite. Moving right along, we have the company Cotivity. They have 1.2 thousand reviews on Glassdoor with a 3.6 out of 5-star rating. They are looking for an audit support assistant. Now again, this is remote for the United States only. But they are looking for somebody to perform a variety of support and general administrative assignments in support of audit or their auditors, including filing, data entry, and tracking correspondence while following established standards and work processes. You're going to obtain data files and generate reports for audits by identifying appropriate file parameters, extracting data from downloaded or imported data files, and you may have to follow and required to review client system and update the systems as necessary. You'll serve as the point of contact to facilitate responses to general inquiries and data requests from both internal and external customers. You'll provide proofing support on claim submittals to double check totals, verbiage calculations, and general accuracy prior to client submission. Now, they do prefer a bachelor degree, but that is not required. Just a high school diploma or GED and 6 months experience in the healthcare field is preferred. You've got to have strong computer skills, again, with those Microsoft Office systems, great communication skills, and the ability to work well both individually and as a team. Now, pay for this position is anywhere from $17.50 an hour all the way up to $18 an hour, and they do offer a standard benefit package that includes medical, dental, vision, life insurance, 401k, and paid time off. Now, the same company is hiring an electronic medical records processing agent. Now, sometimes when I think medical records processing agent, I think taking inbound phone calls and giving people their medical records who are requesting access to it. However, this job does not state that there's any phone calls involved. You're just going to be retrieving and processing electronic medical records through their provider's medical records system, so the electronic online medical records system. You'll retrieve these records electronically. You'll prepare and transmit the records through standard processing procedures. You ensure that the job processes are working appropriately and troubleshoot any errors when required, providing steady feedback to the electronic medical record coordinator and retrieval leadership. You will have to participate in training sessions with the provider's representatives, and you'll complete all responsibilities as outlined in your annual performance plan. So this sounds just like an administrative electronic medical records job. Again, only a high school diploma is required. They do want you to have the ability to communicate clearly, the ability to pay close attention to detail, and be able to learn new electronic medical records systems. Of course, because this is in the healthcare field, you'll have to be able to follow HIPAA guidelines. Now, unfortunately for this medical records position, they did not list the pay in the job description. That'll need to be discussed at the time of the interview. Up next, we have the company Multiplan. They have a 400 reviews on Glassdoor with a 3.7 out of 5-star rating. They are hiring a dispute resolution specialist. When I think of disputes, I think of insurance companies not paying a claim and then you having to dispute with the insurance company why they should pay it. You sometimes provide medical records and any documentation that you need. So they are basically looking for somebody to manage arbitration caseload, including evaluation of provider disputes and appropriate client payment offers. So you're going to assume the primary responsibility for determining appropriate amount of client plan arbitration offers. You'll draft briefs and offer persuasive documenting arguments supporting client positions in arbitration packages. You'll conduct your due diligence by doing online research, portal and application research. You'll work internally with other departments to get any information that you need, and you'll review and analyze critical information along with the documents submitted by the providers for a high or moderate complexity. You'll meet the federal filing guidelines and turnaround times, and you'll respond timely to all electronic, written, and verbal communications. You may have to occasionally do some provider outreach for missing information if it is needed, and of course you're going to have to comply with HIPAA guidelines. So basically Multiplan is like an insurance company. So when providers, like I just said at the beginning, are disputing why the claims weren't paid, you've got to review the information they sent and determine if you are going to offer some kind of payment on the claim or not. Now the salary for this position is anywhere from $50,000 a year all the way up to $55,000 a year. And they don't require any kind of college degree. They always prefer a bachelor degree, but only a high school diploma or GED is required with 4 years experience in some kind of healthcare operations. Of course, you have to have good organizational skills, analytical skills, and be able to think independently and make decisions quickly. You need to be a problem solver, be able to learn quickly, and be able to work independently. And again, with those Microsoft Office systems, you need to know how to use Word, Excel, and Outlook. Real quickly, if you've made it to this point in this video, leave me a comment down below and let me know. Let me know what types of healthcare jobs you're looking for. And also remember that sharing is always caring. So if these job leads were not for you, please share this video with all your friends and family. Share anyway, even if you did apply to these jobs. We all want to live our happiest, healthiest life with that great work-life balance of working from home. So the more we can get this out there, the more people that we can help. But with that being said, next up is Advantia Health. Now they only have 7 reviews on Glassdoor, so please make sure you're doing your research on this company. They do have a 3.0 out of 5-star rating. They are hiring a credentialing specialist remote for the United States. But they're basically looking for somebody to be responsible for maintaining accuracy of their clinicians' or doctors' information, submitting the initial and re-credentialing applications to hospitals and insurance companies or payers, as well as maintaining license and certification renewals. So you'll maintain each individual clinician or doctor files to include updated information needed to complete the required. You'll have to work with governmental and commercial payer credentialing applications, apply for new applications, as well as renew annual licenses. You'll complete revalidation requests issued by government payers and complete the credentialing and re-credentialing applications to add clinicians to commercial payers, Medicare, and Medicaid. So basically, insurance companies require all doctors to be enrolled and credentialed and licensed for their individual insurance plan to be able to bill that plan. And there is not a lifetime registration. You have to keep reapplying every so often. So you'll just be handling the paperwork for all that, making sure these doctors are enrolled and up to date with all of these insurance companies. Now, they don't require any kind of college degree, just a high school diploma or GED. They would like somebody who has 3 years of experience in some kind of healthcare credentialing field, someone who has a knowledge of medical clinician credentialing of principles and policies, someone who has working knowledge of hospital operations, operations, and the ability to use independent judgment and manage and impart confidential information. Now again, pay was not listed for this position in the job description. I don't have any additional information outside of this. You'll have to ask that at the time of the interview. And last but not least, we have the company Advent Health. They have about 2,000 reviews on Glassdoor with a 3.9 out of 5-star rating. Their job description is very small, so I will try to blow this up in editing as much as I can, but they're hiring a revenue cycle specialist. This is remote again for the United States. Now, one thing to quickly note, it states that their benefit package that includes health insurance, paid time off, all of that, starts on day one of your employment. But this is another billing and follow-up position. They're looking for somebody to be responsible to follow up on third-party claim reimbursements for the identification, billing, and collection of payments from insurance companies. You'll be responsible for performing and processing accurate billing procedures for all payers electronically through SSI. SSI is a clearinghouse that is used a lot for hospital facility claims. I assume they might be able to process physician claims as well through that. But you'll make sure that the claims go out correctly. Insurance reimbursements are going to come in based on clean claims. So once the claim goes out, you'll ensure that the accurate insurance reimbursement for all government and managed care payers are coming in. You'll update the high volume of daily claims appropriately in the SSI system. You'll monitor and audit the status of any errors, and you'll maintain communication between the external and contracted agencies and process and record the audit notifications daily. Now again, they are not requiring any kind of college degree, just a high school diploma or GED, 1 year experience either in healthcare, finance, accounting, banking, insurance, billing, or some kind of related field, and 1 year of college can be substituted for any experience. So no experience is needed if you have at least 1 year of some kind of college experience. They do want somebody who has computer skills or data entry skills and can do basic computer functions. All right, if you've made it to the end of this video, thank you so much for watching and supporting me. Please let me know down below in the comments if there's anything specific that you're looking for. You can leave any education and experience that you have. I do read those and keep that in mind when I am searching for job leads to share. Again, if these job leads were helpful, give this video a thumbs up, like button, and share with all your friends and family so we can all work from home. And I'll be back really soon with more work from home job leads just for you.